This is Miss Anis. No chest pain, normal heart rhythm, and stable vitals. But as she runs, something is wrong. Standard tests indicate that she is fine, but she knows something is not. To find this out, we need tools that go deeper, the ones that can see what a stethoscope can't. Tools that let us track blood flow, detect damaged tissue, and see what is really happening inside the heart. And surprisingly, we do it using something invisible, a tiny amount of radioactive material. This is the science behind radioactivity in cardiac diagnostics.
So to solve Miss Anya's case, we have to start with the foundation. So it starts with something small, which is radioactive or unstable atoms. So at its core, radioactivity is about unstable atomic nuclei transforming and releasing energy. So it is simply unstable atoms letting off tiny bursts of energy, like small light bulbs. And we have learned to use these light bulbs to see inside the heart. We inject a special safe substance called a tracer into the patient. Think of it as a tiny messenger. It travels with the blood deep into the heart muscle. If blood is flowing well, it reaches the heart muscle without a problem. So the technique that we use here is myocardial perfusion imaging, or what we call as MPI. Myocardial refers to the heart muscle, while perfusion means blood flow. So MPI essentially means mapping the blood flow within the heart muscle itself. The most common form of MPI uses a technique called SPECT, which stands for Single Photon Emission Computed Tomography. We achieve this by injecting a special, safe substance called a radio tracer into the patient. For MPI, a common tracer is technetium-9019M, a gamma emitter. It travels with the blood deep into the heart muscle. The amount of tracer that settles in each part of the heart directly reflects the blood flow to that area. More blood flow, more tracer absorbed. Our technetium-9090M tracer undergoes gamma decay, emitting a single gamma ray photon. The SPECT scanner has rotating gamma cameras with scintillation detectors that capture these photons. By detecting thousands of gamma rays from different angles, a computer reconstructs a 3D image. Areas with good blood flow appear hot, while reduced flow areas appear cold. This allows us to diagnose coronary artery disease, which is CAD, by pinpointing where blockages might affect the heart's blood supply. If parts of the heart don't light up as brightly, that gives us a big clue. It tells us that not enough blood is reaching those areas, possibly due to a blockage. And this is important for solving Miss Anya's case. And also, there is something that patient needs to know before taking an MPI scan. The patient has to take a stress test, like running on the outside or running on the treadmill. This is because blockages that are not obvious at rest might only show up when the heart is working harder and needs more. If a patient can exercise, we can use medication to stimulate this stress.
When we talk about MPI with PET, we are moving to a more advanced imaging modality. Unlike MPI that uses SPECT, which will detect a single gamma ray, PET will trace emitted positron. We can't deny that most hospitals are still using MPI for cardiology diagnostic, but this technology has evolved in order to provide us with a greater resolution, like upgrading a basic photography to a high-definition video. This is where positron emission tomography (PET) comes in. When a positron meets an electron in the body, they annihilate each other, producing two gamma rays that shoot out in the exact opposite directions. The PET scanner detects this pair as gamma rays simultaneously. This coincident detection allows for higher image resolution, more accurate quantification of blood flow, and less image attenuation compared to SPECT. This means clearer and more reliable data for diagnosing cardiac conditions. So with MPI PET, we can get an even clearer image of the blood flow to the heart. It helps us pinpoint problem with a greater accuracy.
The most powerful application in our arsenal is MPI PET with FFDG. Fluorodeoxyglucose is a special radioactive tracer that mimics glucose, which is the heart's primary energy source. Healthy heart cells consume glucose. If heart tissue has reduced blood flow, but still actively takes up FDG, it means the tissue is still metabolically active and viable. It's just hibernating or stunned due to lack of oxygen. This is critical because such tissue can recover if blood flow is restored through intervention like bypass surgery or angioplasty. For this, we use very special tracer called FFDG. Think of FDG as a sugar detective. Healthy heart cells gobble up sugar for energy. If a heart cell is alive, even if it's struggling for blood, it will still try to take in this sugar tracer. But if it's dead, like scar tissue, it won't touch it. By comparing the blood flow from our earlier PET scan with the sugar map from FDG PET, we get the ultimate clue. If there's low blood flow but the tissue is still taking in sugar, it means that part of the heart is alive and can be saved with treatment. But if it's a cold spot on both scans, sadly, the tissue is permanently damaged.
So the case of Miss Annie's heart problem solved. It turned out to be CAD. Started as an unexplained symptom, become a clear diagnostic. Using the tools of radioactivity and cardiac diagnostic, we have seen inside the heart like never before.